Is it actually possible to stretch your IT band? This is a question that I get asked basically daily in the clinic. In fact, I made a short video about this a few months ago, and I got a lot of comments on this video because in it, I claimed that you could stretch your IT band. Now, it was a short video, so I didn't get the time to actually explain things in depth, which is why I decided to make this video today. So today, we're going to be discussing, can you actually stretch your IT band? If you can stretch your IT band, what stretches are best for you? We'll be discussing whether or not you should use a foam roller, as well as the fact I'll show you my favorite stretch for the IT band. And watch till the end because I'm going to include the stretch that I put in that short video, which is my favorite IT band stretch. Alrighty friends, can you actually stretch the IT band? I'm going to end the suspense right now and tell you no. You cannot actually stretch your IT band. Let me tell you how I know. There has actually been research and studies that have been performed on cadavers that are not embalmed, okay? So they have no chemicals in them. They actually have taken a huge hook and put it underneath the IT band and lifted up the entire body. And while they did that, the IT band barely moved. And this is with the weight of an entire body on it. So does the IT band stretch when it's inside your body? No. The research is clear, it does not actually stretch. So when people are talking about stretching your IT band, they're not actually talking about stretching your IT band per se. Your IT band is a very thick piece of fascia. You have fascia throughout your body from your head to the tip of your toes, but the IT band is a very, very thick band, so it has a special name. Now, it does have some muscles that attach into it and some muscles that it attaches to. Particularly the gluteus medius and the rectus are two muscles that are at the beginning of the IT band. So the IT band kind of comes out of them. So when I talk about stretching the IT band, what I'm actually talking about stretching is the gluteus medius and the rectus. Now, I don't always say something like that in a video and maybe not even in the clinic because sometimes that's just a little bit much for people to absorb. However, if you are talking to someone who says that you can stretch your IT band, I'm here to tell you definitively that it cannot. And that's what I told the people in the comment section on that video, that they were actually right. You couldn't actually stretch the IT band. And I appreciated the fact that they were pointing it out because it told me that I needed to make this video. Now, that may seem super controversial to you because somebody who you know and love and appreciate and maybe work with on a regular basis, such as a physical therapist or a personal trainer, has told you that you should foam roll your IT band. Not exactly. Here's the thing, if you foam roll directly over your IT band, so that's like when you're laying on your side and foam rolling on the side of your thigh, you are not going to get any great benefit from that other than the fact that it's going to be excruciatingly painful. You see, the IT band itself does not stretch, as we've already discussed. It also does not have great blood supply. So you're putting a ton of compression on there, you're causing a little trauma in there, but you're not really getting the benefits of having that trauma response from your body because there's not great blood flow. Now, I do know that some people will recommend foam rolling the IT band either where it inserts into the quadricep on the front or where it inserts into the hamstrings on the back. Now, the IT band does insert into those two muscles, and those muscles do have really good blood flow. So it can be helpful to do some IT band rolling if you're doing it more on the front of your thigh to get the quadricep and IT band connection, or the back of your thigh to get the hamstring IT band connection. Then when you're doing the rolling, you're causing a little bit of micro trauma, but you do have that good blood supply so your body can come heal it. That can be a very effective way to use the foam roller to stretch your IT band. However, I would highly recommend that if you are working with someone who's recommending that you foam roll right over your IT band, that you question them about that. Because one, it's extremely painful. And two, what's the real benefit? So the IT band itself does not stretch. The muscles that are above it or around it do stretch. Therefore, if we want to stretch the IT band, what we really need to do is stretch the muscles around it. And I'm going to show you my favorite ways to do that. So the first stretch that I recommend, that's the least aggressive stretch to start with, is the figure 4 stretch. To do this, you're going to put one ankle on the opposite knee, and this may be enough of a stretch for you. I have some patients who this is a really challenging position, and I just have them do this and breathe into it. Now, if you're like, yeah, I don't really feel anything in there, you can add a little bit of overpressure to your knee, so you're pushing your knee away from your body, and that can help to get a good stretch on the outside of the hip. Now, if that's not enough of a stretch for you, you can bring the opposite knee towards your chest, reaching behind your thigh to hold it there, and that will get a nice stretch up through those glutes and into that IT band. I recommend holding the stretch for 10 seconds, resting for 10 seconds, and doing a total of 3 repetitions on each side. So the next stretch is going to be way more aggressive. So I want to put a word of caution in here. If you have any low back pain or any low back dysfunction, or you've suffered with low back pain recently, I do not recommend this stretch for you. It is very aggressive. It's going to get the hip and a little bit of the low back into it. So for people with low back pain, it's not my favorite stretch, but the next one, which is my favorite stretch overall, is going to work really well for you. But if you tend to have pretty bendy hips and you don't suffer with any low back pain, then you're going to love this stretch. What you're going to do is you're going to kind of wind yourself up. So you're going to put one foot over the opposite knee. Now you need to be sitting up nice and tall. You can't be slouching into this. Weird things are going to happen if you do that. Sitting up nice and tall so you've got equal weight through your cheeks still, even though you're sitting in a twisted up position. If you cannot get equal weight through your cheeks when you're in this position, the stretch is not going to work for you because you're not going to be able to get the muscles to actually stretch the way they need to. So you got to have equal weight. Make sure you've got that before you move on. Then you're going to take your elbow and push it against your knee, which is going to turn your upper body to the opposite direction. So I've got elbow pressure is going into knee and lifting it up and that away, as well as this hand that's helping to anchor me here, as well as keeping me up. Now this is a pretty aggressive stretch. You're pretty wound up here. So you want to hold it for 10 seconds, relax, do the other side, and then you can do that for a total of 3 repetitions. All right, so now I'm going to show you my favorite stretch when I'm trying to change my IT band. This is a stretch that's going to really hit that gluteus medius, which is right here, that rectus, which is right in front, and it's easy to kind of tilt and adjust a little bit. You're going to cross one foot over the other. So for right now, I'm doing my left foot over my right, and then you're going to stick your right hip, in this case, out to the side. Now, what I love about this is that you can kind of play with it. So you can kind of go a little bit out to the side, a little bit out to the side and back, a little bit out to the side and front until you find that good stretch. Now you're going to feel it more up in your hip as opposed to down your IT band. You're not going to feel as much tension in there, but remember, we're trying to get those muscles in the hip to stretch because that IT band doesn't really stretch very much. You're going to hold that for 10 seconds. Again, I recommend doing both sides, and you're going to do a total of 3 repetitions. All right, there it is. We have answered the question, does your IT band stretch? No, but the muscles around it do. Should you use a foam roller? It's not my favorite thing, but if you do, definitely use it more on the front to get the quads or more on the back to get the hamstrings where the IT band inserts. If you're trying to stretch, I prefer trying to stretch the gluteus medius and the rectus, which is where the IT band originates from. However, if you struggle with a tight IT band, you are going to have to stretch it regularly. And by regularly, I mean daily. And you've got to keep stretching it even when it feels like it's nice and flexible because you want to maintain those results for the long term.